evening. Alright, so the fourth antiviral drug we should be discussing this evening is what is known as what? Abacavir. Okay, so we're talking about the pharmacology of Abacavir. Okay, all about drug and everything okay the drug does and all of that. So Abacavir, I have the picture right here. My screen, you don't have to worry. I'll upload it okay on the Pharmacology YouTube channel. So Abacavir, as a way of introduction, you should know that it's a nucleoside reverse transcriptase inhibitor. Okay, so it's usually used in combination with other drugs, okay, mainly for treatment of HIV. So what's the full in-depth into the drug now? It's an antiviral drug. It's a nucleoside reverse transcriptase inhibitor. It's a guanosine analog. Okay, so let's look at how this drug actually works now. It goes into the cell. When it goes into the cell, it is converted to an active molecule or active moiety. Do you understand? This is what is known as a carbovir triphosphate. Okay, so the active metabolite will now compete with natural nucleotides. It will go into the viral DNA. It will stop the virus from making other copies of itself. You say there's a chain termination. Okay, so this will now stop the HIV virus from making other copies of itself, which would have made the disease condition worse. Do you understand? So you're basically trying to halt that movement. So pharmacokinetics, absorption is rapidly absorbed and usually given in the oral route. Distribution is widely distributed, can even go into the cerebrospinal fluid. Metabolism is via the liver, okay, via the alcohol dehydrogenase and the glucuronyl transferase. Elimination is through urine. Half-life is about 1.5 hours. Now therapeutic uses is mainly for HIV infection. Okay, so you combine it with other drug, and that's what they call the antiretroviral therapy. They call it the ARTs. Okay, so you combine it with other drugs like what? The lamivudine and the dolutegravir. Okay, so that's what we got. So adverse effects can cause nausea, headaches, fatigue, rashes, then gastrointestinal upset. Okay, then rare adverse effects like what? Hypersensitivities. Okay, so that's what we have done with